Okay, so we are doing testimonial for PRP injection. I'm Joe, and this is,
Joanne A.
and Joanne, how old are you if you don't mind giving that information?
I'm in my 40s right now.
Perfect. And first question, Joanne, what was life like before your Regenix treatment? What were you
So
not able to do that made you upset?
so I got injured around October 2022, and then I reached out to Dr. Dwight's company like around December. So prior to that, I was very much active. I was doing CrossFit, I was hiking, I was running. But after I got injured, my injury was a meniscal tear. So after that, I couldn't even walk without pain. I had to wear a brace and was limping around most of the time. So basically that a lot of things, I lost a lot of things like in terms of physical activity, like even going for a walk for my kids with my kids, I couldn't do it anymore. So it was not comfortable at that point.
And do you mind me asking which knee was this?
It was my right knee. It was
Okay,
my right knee, so which is
okay,
harder because it's my driving knee as well. So it's kind of hard.
okay.
Yeah.
All right, next question. What finally triggered you to come and meet with our medical staff?
So prior to meeting Dr. Dwight, I already know about PRP from way before, but I never had like firsthand experience of actually doing it for myself. After I had my injury, I did go to an orthopedic doctor who suggested that I actually do need surgery, but I'm not ready for an actual surgery at that point. For me, if there's another way of healing my knee, I would rather do that without cutting my knee open. So that's one reason that I went to Dr. Dwight because I know that he does specialize on regenerative medicine. So
Okay,
that's the reason why I went.
okay, thank you. What kind of concerns did you have prior to the procedure?
Um, of course, one of the things that I have to think about, does it really work? Or one of the things also that I was very much concerned of, is it gonna be painful? So, but I think with the results that I got, I think first and foremost, it does work. In terms of the pain, Dr. Dwight made it very much comfortable for me while he was doing the procedure. So he was very much on top of the pain that if I'm gonna experience it or not. So that
Okay.
kind of did help.
How was the procedure like when you came in?
Um, it was I was nervous, I would say. But then, like what I said, Dr. Dwight made it very much comfortable for me, and it wasn't that bad as I thought it was gonna be. So
Okay. All right. And what kind of downtime did you have after the procedure? When did you return to work and or your activities?
Um, as for my downtime, I had the procedure done on Saturday. I I'll be honest, I actually right after the procedure I went to a party. But you shouldn't do that. But then it wasn't as bad. Like I went there for like an hour and then went home. As for since it was a Saturday, I was able to get back to my normal routine. I was back to work like Tuesday.
Okay.
So it wasn't that much of a downtime. There is a little bit of discomfort, but then it's not as bad.
Okay. Okay. So what is life like now?
As in comparison to my October situation, right after I had my injury, it's a lot better. Yesterday I did go for a walk with my kids. I was able to tolerate like 45 minutes of walking, but no running yet at this point. I'm kind of want to make sure that I don't re-injure it again. So it's a lot better. I could move in bed without having any recurrence of pain. So going up and down the stairs is a lot better. And I could drive a little bit easier without experiencing sharp shooting pain in my knee while in the highway. So that's
Okay.
still a plus.
Good. Okay. And then lastly, what would you tell someone considering regenerative medicine?
Oh, go for it. I would say that go for it because it's the best. I feel like if you're young and even if you're old, I feel like there's still it's still a lot better than having you getting cut open. So the recovery time is still a lot easier than versus to getting cut open. So I would say go for it. Because and then I do actually tell my patients as well to see Dr. Dwight Lynn, so in that way they would get a better perspective of what to expect and if it's for them or not. So yeah.
Thank you. Okay, Joanne, was there anything else you wanted to say?
No, I thank Dr. Dwight Lynn and Miss Joe for helping me out so much
Oh,
in accommodating everything.
you're welcome. All righty, Joanne. Well, thank you so much.